going on, everybody? Today's a video about trying to treat low back pain when it comes to squatting and deadlifting a lot in your routine. A lot of people that they squat heavy or they squat a lot or they deadlift heavy or deadlift a lot will get sore low backs that extend past like delayed onset muscle soreness. They'll just feel like their back is always hurting in some way. They'll wake up and their back will already be sore. And these are a few things you can do to fix it. But the first thing that you need to find out is why it's happening to you. So there are 7 main reasons that it could be happening. Number 1 is weak abdominals. A weak core can cause overcompensation in the low back. You can also have weak abductors and adductors in your hips. You could have a weak psoas muscle from sitting all day, so that's a hip flexor. You could have compression of the spine without decompression. Compression of the spine isn't bad in and of itself, but if you're not getting any type of decompression, then it can build up over time. Low mobility in the spine, hips, and the ankles is number 5. Number 6 is iliopsoas tightness, so not just weakness can cause this, but a tightness can as well. And then the last one is an SI joint dysfunction or a sacroiliac joint dysfunction. So the first thing that you can do is called a seated gluteal release technique. And all you have to do is find the edge of a seat, preferably something that doesn't sink in a lot. And you come up to the front so you're barely sitting on it. Feet are gonna be shoulder width and pointed straight forward. You're gonna kind of arch your back and put your hands behind your head. And then the goal here is to flex your glutes really hard for 5 seconds and then relax. And you wanna flex them in a way that you kind of feel like you see me move up a little bit. You really wanna flex up. And then you're gonna relax. And I'll show you from the side view here. So it's gonna look like this from the side. Back straight, a little arch, and then you're gonna flex, hold, 3, 4, 5, and then relax. Flex, like that, 5 seconds, and you wanna do that 5 times. You can do that 1 or 2 times a day, and that's the first thing you can do. So number 2 is the seated rotation. This one's pretty simple as well, and there are 2 ways to do it, and I'll show you both. The first way is same position as the other one, and then the side you're rotating toward, you put that foot out slightly, and you're just gonna put your opposite hand and pull. And you want to relax everything here so you can feel a stretch in your low back. Sometimes you'll feel it in your abs. You wanna hold that for about 10 to 15 seconds. And then you're gonna go ahead and switch sides. I'm a little tighter to my left. And then come back. The second way, it's with a little bit of lateral flexion. So you're gonna do the same thing. Put the foot out to the side you're gonna rotate, but then you're gonna laterally flex to the opposite side, and then you're gonna rotate. And a lot of the times you'll feel this a little bit lower in your back. So a little bit of flexion, and then rotation. And that's number 2. So the third way is a spinal decompression technique, and I'll show you 3 ways to do that. The first way is seated, so same thing as the first 2. And you're going to get in the same position, but then drop your hips down to below the surface, lean back a little bit, and kind of pull up. And you want to let your lower body stay below the seat and just lean into it. And I can feel that there. You know, you've probably seen a lot of people do that on like a kitchen counter or something. You put your elbows up and lean forward and then let your lower body just relax, and you'll feel it right in your back here. The thing that you want to be feeling with this is like a slightly uncomfortable stretch feeling. Maybe initially there's a little sharp pain, but then that goes away. If it's constantly sharp through the whole thing, then I would say hold off until a few weeks later when you've done some of these other exercises and try it again and see if it still gives you that same pain. So this is kind of like a representation of your kitchen countertops, but you would want to put your arm and your elbow there, lean forward, and then just, I'm coming up off the ground, but you just want to let your lower body dangle there a little bit, and you'll feel that right there in the back. So the third way is just hanging from something above you. So a pull-up bar, a tree branch, something you can find in your backyard, whatever. And same kind of deal, but in this one you can get a little bit more motion in your lower body. I'll show you. So once you're holding on, same thing, relax everything, and you can either just hold it or you can kind of spin a little bit. But the main goal here is just decompressing your spine. All right, so for the next ones, we're bringing it to the ground. You can do this on the bed, on the floor, on a couch, wherever you have room to do this. So the first one, we're gonna be kind of like Shakira here. You want to lay on your back with your knees up, And then you want to arch your back and then push your back into the mat. Arch your back, push your back into the mat. You want to create this space here and then flatten it out like you're trying to push into the ground with your lower back. Now if you were Shakira, you'd throw your hands up like this and work yourself with your low back. The next one you're going to want to do is also simple. Laying on your back. Now you're going to bring your feet together and your knees together, and you're just going to let your legs rotate left and right out to the side. And you can go all the way both ways if it doesn't give you any pain, but if even this gives you some pain, just rotate within the parameters of not having pain. So if it hurts right here, stop here and just go back and forth in that spot. So the third one, you're gonna have to grab a ball, a pillow, anything you can put in between your knees. And same thing, lay here, feet shoulder width. You're gonna squeeze the pillow or the ball for about 5 seconds, and then you're gonna relax. Don't drop it, especially if you're a guy. Just squeeze it, and then relax. Carefully remove. That's the third one. The fourth one, you're coming on to your hands and knees or your knees and elbows, and this one's called the cat-cow. Same kind of thing we did for the first one, laying on your back, but now you're on all fours and you're gonna do the same thing. So arch your back here, push your back up, arch it, push it, just like that. Now the last one, the most advanced, is on all fours. You're gonna lift one arm and then the opposite leg. The goal is to get them straight out and bring them back in. Straight out, bring them back in. If that's difficult, you can do one at a time. Just mess around with it. You don't have to straighten the leg, you can keep it bent. But the ultimate goal is gonna be to get those opposite diagonals. So those are the ones on the ground. All right, this next one is a stretch. It's a lunge stretch. So we're trying to stretch the front of your hip. You're gonna get down in this position where it's a 90 degrees, and the goal is just to lean forward like this. So you want to lean your hips forward here. You don't want to lean your upper body forward. You're trying to stay upright, activate this glute here, and lean forward. And even me, I feel like I'm relatively flexible. I can already feel that right there. And you're just gonna push your hips into it. If you're a little bit more advanced and you're not really feeling that, you can also turn it into an isometric exercise by taking that knee off the ground and feeling it in the hip right here. Once you have 30 seconds of that, you can switch to the other side. Same kind of thing. Sit into it like this. You don't want to lean forward. I don't feel that in my hip at all, but this is already feeling it in the hip for sure. Same thing, you can push it up, whatever. This is the hip flexor stretch. So this next one is an iliopsoas hip flexor and abdominal activation exercise. So if you have something to hang from or something to kind of prop your elbows up on or hold yourself up on, you're gonna wanna go to that now. So first one, hanging, same thing, hanging position. Then you want to activate your core. So you see how I'm kind of crescenting at my body? And then from there, you're just gonna bring those knees up. You can do it with the knees. You can do it full leg, but you want to make sure your core is activated so you have that anterior or posterior pelvic tilt, and then you're lifting up your leg. You can also do it either on your hands. So here I'm just dangling, activate the core, and then you want to pull those knees up. You can do it bent, you can do it straight. You can also do it just on your elbows. Same thing here. Keep that core activated the whole time, and you'll feel that one right through your hip flexors and your lower abdominals. So for this next exercise, it's also going to be an iliopsoas activation exercise. You want to find a seat, preferably rigid. Get your feet shoulder width straight forward, and then you're going to lift one side and take the opposite hand and push down. So you're pushing up with your leg and down with your hand. That's going to activate that psoas muscle. You're going to hold that about 5 seconds, and then you're going to switch. And I like to put my hand here instead of out here just because I feel like it works on my balance at the same time, but you're gonna go back and forth like that. And this one's gonna work that iliopsoas muscle. So when it comes to strengthening your abdominals to help reduce low back pain, I feel like the two things you can do that have the best effect are isometric ab exercises, so a holding exercise like a plank, or you can do isolateral carrying exercises, or you can do, well, technically three, you can do your normal lifts that you would wear a belt for and just don't wear the belt. When it comes to the general public though, it would be isometric exercises and then unilaterally loaded or isolaterally loaded exercises. So that could be something like picking up a heavy dumbbell, carrying it across the room and back in just one arm, and then switching, doing the other side. It can be doing lunges side to side instead of just straight forward. It can be doing anything that challenges your balance at the same time that you're doing something with resistance. But planks, side planks, any isometric ab exercise, and then things that challenge your core, either not wearing a belt while you're doing compound lifts, obviously within a weight that you're not going to injure yourself further, or unilaterally loaded exercises. Okay, other than these specific exercises I've shown you, the general gist is those muscle groups we talked about that can cause this issue due to weakness. Just try to strengthen those exercises. If your abs are weak, do abs. If your hip flexors are weak or tight, do hip flexor exercises or stretch them. If your glutes are weak, do glute exercises that are isolation exercises, not just compound, because you will get a lot more compensation in compound movements. Other than that, you can spend a little bit more time doing something like a dead hang or lat pull downs right after your squats and deadlifts to get some of that decompression. And you can also do things like carrying heavy weights or doing skipping to increase the balance, increase your core strength, and increase that hip flexor use. So you're not just doing a bunch of, squat and deadlifts or hip extensors. Put some type of hip flexor in there. All right, guys, to put it all together, you can work any of these things into your normal lifting routine. 5 minutes of walking warm-up before you do your compound lifts can help. 5 minutes of stretching of your hips and your lower back and your spine before you do your compound lifts can also help. Do your lifts with intermittent glute and psoas activation movements in between sets. So if you've watched anything like Squat Every Day, he'll do a set of squats and then do some hanging psoas activation movements, and then he'll go back and do the next squat. It helps him feel better during the lift. Really focus on your proper posture and stabilizing activation during your lifts. After your compound movements, I would work in a decompression movement like lat pull downs or pull-ups or hang. Work in abduction, adduction machine movements directly after your compound movements. So squat, deadlift, go on to the good girl, bad girl machine and just work it. And after all that, you're done. You can do more mobility after your workouts, other days, your off days if you'd like to. You can take up yoga, you can take up Pilates, whatever makes you feel better. Hopefully you learned something from this video, and if this helps get rid of some of that lagging back pain or nagging back pain, then comment below. Have a good day.